Hello, welcome to the Nurses Heartbeat podcast, where every heartbeat tells a story of care, compassion, and community. My name is Philip. I am nurse by background, and I am the host for the podcast. So today we want to look at the topic promoting kidney health. This is as part of marking the World Kidney Day, which takes place every 13th of March. So I have here with me Mike. Hello, Mike.
Hello, Philip.
You are welcome to the show.
Thank you very much.
So, can you tell us a bit about yourself?
Yeah, thank you. Hi, everyone. My name is Michael, as I have already been introduced. I'm also a nurse by profession, and I have known my good friend Philip for quite a number of years now. And it is an exciting day to be here at this moment to talk about kidney health. I've been in this health profession for roughly 8 years. At the moment, I'm a nurse in the emergency department. So what's an exciting day to be here? Yes, we see a lot of kidney problems, people coming with kidney issues. And I must say that I'm happy to be part of this conversation as we mark the World Kidney Day in this year 2025. That's powerful.
Delighted to have you here.
Yeah, thank you very
So,
much.
going
It's my
straight
pleasure.
to the topic, we want to look at the kidneys. What actually does the kidneys do?
Yeah, I think the body is quite a complex system that consists of a number of organs, of which the kidneys are also part. So there are two of them, one on each side of the body. If you take the body where your waist level is, if you hold your hand like that, just at the back on either side, you have two kidneys, and they are very important organs because they carry so many functions in the body, without which the body will barely function. So the first one I would like to talk about is filtration of blood. So all the toxins, the food we eat, when they go into the bloodstream, after the good part has been utilized by the body, the toxin needs to be excreted in the form of waste. So it's the duty of the kidney to filter every blood and take out these toxins to ensure that we are safe and we don't keep poison in our body. Yeah,
That's good. So, the first point we are making our audience and listeners aware is the filtration.
yeah,
That is quite enormous.
yeah. So to throw more light on, we take in salt, we take in meat, food. When they are broken down, we have byproducts, which when remains in the body can become very toxic. So every blood that flows need to pass through this kidney, and within it we've got some micro unit structures that carry out the filtration process. And yes, I must say it's a masterpiece, and it's a masterpiece of an artwork that is.
So I know that one of the functions is also to regulate blood pressure. How does the kidneys also help in regulating blood pressure?
Into play when it comes to blood pressure. So the first thing I'm going to talk about is salt maintenance. Sodium is one of the elements that naturally attracts water. So wherever sodium is, you will see water. Again, in the body, when the threshold of sodium is reached, the duty of the kidney to push the excess ones, without which they will remain in the body and begin to suck more water. And when it happens like that, it increases the volume of circulating blood, and it puts more pressure on the heart to pump, and it can give rise to high blood pressure. So that's the regulation of the blood pressure.
One of the functions of the kidneys is also to regulate electrolyte balance. So normally we have potassium and other electrolytes that the kidneys help to regulate them so that they have a balanced level in the blood.
Yeah, that reminds me, the potassium you just mentioned is a crucial element in heart contraction.
Okay.
So we don't want too much of it, and we don't want too less of it, without which the heart cannot really function very well. So again, it's the function of the kidney to ensure that at every point in time there is that threshold, good amount of potassium in the bloodstream. The kidney trades potassium for sodium, depending on the level of each of these elements, to make sure that our muscles, heart muscles, and other muscles of the body are in good health to make it function. So yes, this electrolytes is a key role in the kidneys.
So most of the time, people, all of us, we do take medications, pain medications and other medications. Does the kidneys actually also help us in when we take these medications?
So yeah, the medication that we normally take, we have the therapeutic parts and the form that become like the waste part of it. So when it happens like that, the liver breaks it down, it detoxify it for the kidney to flush it away from the body. So yeah, drugs and toxins, adequate hydration is a work again of the kidney to ensure that the byproducts, the wanted products of the drug we take are flushed out of the body. And this is again done by the kidney. So the kidney is an amazing organ that we have in our body. Yeah.
Great. Is there any other thing you want to talk about?
So
regarding the things or
with the work of the kidney, quite important to also know that when it comes to production of blood, there is a particular hormone required, erythropoietin, which regulates the production of red cells. People who suffer kidney problems like kidney tumors, which suppresses the release of this hormone, sometimes they have chronic anemia, they have low blood levels. So again, the kidney helps to enhance the production of blood cells, which is crucial for the function of the body. Also, it helps to activate vitamin D, which is a good component to help with bone growth and bone development.
So we want to look at some common conditions that affect the kidney. What are some of the disease conditions that normally affect the kidney?
Yeah, so by practice, we've come across a lot of people presenting with disease of the kidney, and most of these arise from like improper, let me say, diet, or maybe lack of awareness of how the kidney function and the things we throw at the kidneys. Because if we are not taking care of the kidney will definitely fight back and will prompt us to let us know something is not right with it. We'll become unhappy, basically. So the first thing I would like to talk about is like chronic kidney disease, the long-term condition where these kidneys gradually lose their function over time. So we bombard it with toxins, we bombard it with drugs, overdose, eating too much meat, too much fat, improper diet, we burden the kidney, and over time it loses its ability to function, and that's called a chronic kidney disease. It can also be precipitated by some medical conditions like diabetes, hypertension, and stuff like that. Yeah. So chronic kidney disease, that's the first one I'll mention. Also, you have what we call AKI, acute kidney injury. If you're not drinking enough, obviously the kidney always feels happy when there is enough water, because this electrolyte, these salts that we've talked about, they dissolve in water before they can be excreted. The amount of water we are taking in is way lesser than what the body needs. They become quite concentrated, and again, they become toxic to the kidneys, and they can cause what we call acute kidney injury. So dehydration, infection, medication, certain conditions of the liver can cause acute kidney injury. And when it comes, it presents itself in form of confusion, swelling, decreased urinary output, sometimes burning sensation, and even foul smell can even lead to urine infection as well.
So acute kidney disease, AKI, in my practice, is one of the most common kidney diseases. Yeah. As you said, dehydration. Normally we go to work and the shift is very busy. We are not able to hydrate ourselves. A lot of water, and when we become dehydrated, we are predisposing ourselves to acute kidney disease.
Exactly. And I think every nurse is, well, over 90% are guilty of this. Sometimes when you are on your shift, you feel like, oh, let me just complete this task. Let me do this one, do that one. By the time you realize you've gone over 5 hours into your shift without even a thought of taking a sip of water. So in my place of work, what we have is like a hydration desk where you can get your water bottle, get some water, and then you can hydrate yourself. Also, they have water fountain at a big point so that even at the sight of it, you'll be prompted to at least drink water. And that, I think, is really helping institutions who work with people in high pressure situations who are tempted to forget drinking, and employ such strategies to keep their staff well hydrated, well watered.
Yeah, so I think the hydration station, they are very good initiatives because nursing NHS workers sometimes not have a busy shift, and that's mechanism really. So we also have other conditions like glomerulonephritis, polycystic kidney disease.
UTI is one of the common presentation we use. Is just urinary tract infection, the urinary system at any point. It could be the urethra, it could be your bladder, your ureters, the kidneys become infected with a bad bacteria. It presents itself in burning sensation, painful urination. Sometimes you have to visit the loo more frequent than you need to in advanced stage with rigor fever, and it can even lead to sepsis. Also, you can feel some flank pains. You touch your flanks, you feel like pains, and these are indicative of it could be urine infection. Again, if you drink enough, if you are emptying your bladder quite enough, you reduce the chances of getting some of these infections.
So let's look at the risk factors. What are some of the things that predispose us to getting kidney infections? So I want us to look at the risk factors.
Yeah, so as I've already mentioned, urinary tract infections are predominantly caused by a bug like a bacteria, viruses, fungi, those stuff. Yeah. But with predisposing factors, again, if you're not drinking enough, the urine in the bladder becomes scanty. It becomes so concentrated. And if you are not urinating quite frequently, it collects in the bladder, and then it becomes a good medium for bacteria to multiply. Because as you urinate more often, as you pass urine, kind of you are flushing the urine out, and you are flushing any bacteria or any bug that might be present in the tract. So people who tend to hold their urine more often, they are at risk of becoming infected with urinary tract infection. Gender-wise, it is noted that females are at higher risk of getting urinary tract infection. I think because of our anatomy, viscous lifestyle, predisposable to urinary tract infection, reduced immune system, and people who are at advanced stage of cancer, and people who are not moving enough, immobility, can also predispose people to urinary tract infection. So overall, if you're not eating well, your immune system goes down, and the bacteria, the bug capitalize on the leverage on our reduced immunity to multiply.
I think the eating and drinking has a great bearing on our kidneys. And in our next episode, we want to talk about that because we also have nutrition day.
Okay,
So we'll look at early detection. How can we detect? What are the means that we can make sure we can identify kidney conditions?
Yeah. So each and every one of us, we know our body, how we function in our optimum state. So at every point in time, if you think your water works is going off balance, just speak to your GP. Don't delay at all. Urinating more frequent than you normally do. If you see any blood coming out of your urinary tract at any point in time, if you pass urine and you notice that this smell is not just the normal smell of my urine, I know, just take an action, ring your GP. If you have any chills, any pains in your flank, speak with your GP. Yeah.
Okay, yeah, great. So we've had a lot of things that you can do, and then I think screening is also an important aspect. So going to have screening done, kidney screening is going to have a lot of importance to identify kidney conditions.
Yeah.
We want to look at how can we promote our kidney health? What are the ways we can follow to make sure our kidney is healthy?
Yeah, so a doctor friend of mine said that if you think your body to be the only car you will be driving till you die, you will take its maintenance very seriously. You've got no other means of transport. So we have only one body to live. So we have only one body to live with or to live in. So every aspect of our health, including the kidney health, needs to be something very crucial to us. We don't have to be naive or passive about our kidney health. We need to stay hydrated. That one is on top of the list. Keep drinking at least 2 liters of water a day. And people who are in the tropics with like elevated temperatures, 2.5 to 2 liters of to 3 liters of water a day is what is recommended. Also, cut down alcohol if you don't want to stop. And due to stop alcohol consumption, cooking, they don't help the kidneys. Also, we need to eat kidney-friendly diets. Eat more veggies. If you're eating meat, don't eat the one that is kind of classified. The hard to digest ones. Just avoid
some soft ones.
Yeah, the soft ones that you will be able to digest. Well cooked. Yeah, because they all tend to put pressure on the body when they become digested. The byproducts, the amines, the amino acids, and the amino acids, and the urea that is secreted. If they are in its larger forms, they become very concentrated and they make the kidney weak. And we don't want kidney to weak. Also, we can reduce our salt intake. We need to control our blood pressure. So again, we're talking about the kidney, but other diseases can precipitate this kidney disease. One is blood pressure and then diabetes. So we need to get screened, just as you said, to rule out any of these diseases so that they don't impact on our kidney health negatively. We do need to exercise. So as you exercise, more blood flows to the kidney. They become active, they function, and they filter the blood very well.
That's great. Talking about exercise, I would just want to add that you can have some walking, walk some distance is going to help. You can do some jogging in the morning or at your free time.
Yeah.
They all are small ways that you can exercise too. Because normally when you talk of exercise, many people think going to the gym, like some aggressive stuff. They are good anyway, but simple walking, jogging are all part of the exercise that's going to help.
I tend to do a lot of skipping some time ago, but I must confess that I have not doing that anymore. Maybe because of work pressure, or I'm thinking of revisiting it anyway. I do a lot of cycling just to compensate for that. Wait, the kidney health again. Sometimes people just self-prescribe medication for themselves when they have headache, when they have any pain. They'll just walk to the chemist, buy lots of over-the-counter medication. They keep taking them as food, but at the end of it, they are putting more stress on the kidney. Again, a friend of mine said if we eat if we take food as our medicine, we won't be taking our medicine as our food. So if we rather become disciplined in the food we eat, kidney-friendly foods will end up saving our kidneys rather than, burdening them, feeding them with these tablets. You resort to the tablets when you are prescribed, because the doctors might have checked your kidney levels, check your liver function to know exactly which tablets will be good for you and the dose which will be good for you. But if you begin to take them on your own because you have any symptom in your body, you are causing damage to your kidneys.
Sure. So over-the-counter medications, people self-prescribe. They just go and they buy it without necessarily taking the right advice or the right prescription. There are people that even the medicines prescribed for other people or other patients, they will say, "Oh, my condition is."
We tend to hear that a lot.
Exactly. So they want to take the same medication, but you don't know the person might have been tested and all of that. You know what is best for the person. So the fact that you have a similar condition that necessarily
You can take that medication.
Exactly.
Because we have different derivatives of medication that does the same job, but depending on your your blood levels, your immunity, your specific needs. The doctors are able to dose the right amount of medication that you will need for such a condition. Yeah.
Sure. So, Mike, we will come to a close very soon.
Oh, okay.
Should anyone be concerned if he or she feels the kidney maybe is not relating well or having any pain or issues with the kidneys? Should we be concerned? What are the immediate steps that the person can take?
Yeah, so just as I said, if you think your body to be the only vehicle you will be like riding in for the rest of your life, the cars we drive, we test them for MO. We go to the MOT every year. If there is any part that is not road worthy, you are going to fail. It doesn't mean the car cannot move, but it's just not safe on the road. It's the same thing. The kidneys are very crucial to our health. If we find any symptom, not just with the kidneys, any other body part, because they all work as a system to make us live healthy. If you feel that anything is not working well with your body, just speak with your GP, speak with your surgery, your doctor, and let them advise you appropriately. And again, with this healthy diet, drinking, and all these things that we have said, if you put them into practice, inevitably you're promoting your kidney health and you're prolonging its lifespan. At the end of the day, if the kidney gets damaged, the doctors, surgeons can put a new kidney in, but it will mean that you have to be on medication for the rest of your life. That is when your body doesn't reject the kidney, sure. Yeah, and it reduces your immune system and it has all its concomitant side effects. Making sure that you value your kidneys, you seek for necessary attention when you need it. These are key to promoting your kidney.
So, listeners and viewers, you said a lot. Personally, I have encountered patients with kidney conditions, patients that had transplants done, and even that one to prevent rejection in the future, you are going to take medications almost every day for the rest of your life, which is very difficult for some people. And then if you don't take these medications too, exactly, it's going to have effects on you. The best way is to prevent than trying to take medication and all of that. There is a saying, prevention is better than cure. So the take home message or simple things I just want to reiterate for us to know is that we should eat balanced diet, more vegetables. We should drink a lot of water. We should make sure that we don't take any medication that's not prescribed. We know that some pain medications normally we can go to the shops, go to the drug stores, we can get them. But we should be mindful of how we take these medications because they all have effects on the kidney. We want to prevent ourselves from getting kidney diseases. That is the motive for the World Kidney Day, rather than trying to find cure when our kidneys have been damaged or affected. I hope you have questions. If you have questions, you can put in the comments. We are going to answer your questions. Many of you may have also had kidney conditions. We want to hear your experiences, how it went through, how the management was done, and how you are feeling now. We are happy to hear from you, your side as well. Mike, do you have anything as we end the session?
I think you said it all. I just want to wish all my friends, my colleague health workers who are out there a happy kidney day. And they should continue. The first one goes to you. And so they should continue with the amazing work that they are doing. We are really proud of them. Thank you.
Thank you very much. So that is Mike. Thank you, Mike, for joining us. Thank you, viewers and listeners. We appreciate your support. We want you to like, we want you to follow us, we want you to subscribe, we want you to share. It's World Kidney Day. We want everybody to be aware how important kidneys are to us and how we can protect kidney health. Thank you so much. We value. We want to hear from you. We want you to listen. We want to share. We will see you. So we have nutrition day, as I said, nutrition day. Exactly. So I'm going to have a seasoned dietitian as well on the show that will also dive deeper into good nutrition, hydration, what we should do. The motive for this is to make sure we live healthy, we stay healthy, because every heartbeat matters. Thank you.